Assalamualaikum and good evening to all our viewers this afternoon. Welcome again to our FB Live interview session KBJ with the frontliners to fight COVID-19. So for those who are watching right now, please don't forget to like our Facebook and don't forget to share with your friends and family. So today we want to discuss about an important topic. So don't hesitate to drop your questions in the comment section. So I'm Norbalkis, your host for today, and with me, not alone, we have Aliza as our host for today. Hi, Aliza.
Hi, Balkis. With me today is none other than Dato Dr. Vasan, an orthopedic surgeon from Pantai Hospital Ipoh, who had been very generous with his time to share his expertise and knowledge with the viewers and the Penang community today. Welcome, Dato Dr. Vasan.
Thank you, Balkis, and thank you, Aliza. And yes, it's a privilege and indeed honor to be online with you with Complex Bukit Jambul on this CSR program.
Okay, Dato. Let's start our live today with the first question. First of all, Dato, can you share with us today how deadly is the virus and why it is called novel coronavirus?
Okay, I think as of today, I think the entire world, it's now a pandemic. Pandemic means it involves the entire world. It's no longer an epidemic, but a pandemic involving everyone. And the COVID-19, as you know, this COVID virus is a new coronavirus called the SARS-CoV-2. And WHO has actually learned from this virus on 31st December 2019. And the problem with this virus is because it causes cases with viral pneumonia, and that causes a lot of problems. And it is a very deadly virus, and it has caused a lot of deaths around the world. So therefore, I think we all need to take extra precautions when dealing with this virus.
Okay, so Dato, when talking about pandemic, so I'm sure our viewers right now want to know more about how we would overcome this pandemic. So I'll give you a sample situation. So let's say if a person have been identified as a close contact of a known COVID-19 cases, so why do the person need to quarantine even if the test was negative? So maybe you can share with us.
Yeah, okay, that's a good question. But as you know, that most patients, about 80% of them who have symptoms or who develop symptoms actually recover and they don't need to go to the hospital. But about 15% of them become serious and 5% of them actually become critical. And it's these 5% that are critical that actually needs the intensive care unit. And the complications that arise are death because of respiratory symptoms, that means from the lung, and also from septic shock, and also from thromboembolism, and multi-organ failure that happens. So basically, this is a virus that is very deadly, and it can cause a lot of harm to any individual who is exposed. And the people that are exposed to it, the ones that actually to worry are the ones that are above 60 years of age and who have loads of medical illnesses like hypertensive, obesity, diabetes, history of cancer. So these are the type of people that actually have to be very careful, especially when they come in contact with anyone who has had who has COVID. All right, but I think most importantly, I think people want to know actually what are the symptoms of COVID. Everyone talks about COVID, but a lot of people are not sure what are the symptoms. If you ask me, the initial symptoms would be fever, dry cough, and fatigue, rasa letih, feeling fatigue, rasa letih. And of course, many of them tell you that they don't have smell, they can't smell. So assuming for people who come from Penang, and many of them like the durians, you suddenly can't smell the durians. Now, when you can't
Okay.
Yeah.
smell the durians, yeah, so when you can't smell, then something is wrong. So you probably need to check. And also nasal congestion, conjunctivitis. Conjunctivitis means something to do with the eye. Headaches, muscle pain, and then sometimes some of them have skin rash, and some also have nausea, rasa macam nak muntah, rasa loya, and of course loose stool, diarrhea, and also chills and dizziness. But these are the less common symptoms. Now, the symptoms that are very severe are shortness of breath, chungap. You feel tired. You climb up a flight
Oh,
of stairs. You say,
okay.
"I feel very tired. I can't breathe." Loss of appetite. You're confused. Yeah. Then you have some chest pain, and you have fever. Your fever is above 38 degrees. All right. So these are the things that associated with COVID-19. But of course, there are also some other less significant symptoms like confusion, reduction in consciousness, meaning that you feel you feel that you can sleep off very easily, anxiety, depression, sleep disorder. These are some of the uncommon symptoms, but all this actually are part of the COVID factor. Okay.
Okay, doctor. How long does it take the symptoms to appear?
Okay, good question. I mean, we don't know how long it takes for the symptoms to appear, but if any of these symptoms do appear, okay, it's best that you observe yourself and see whether you have any of the symptoms. All right. If you do have any of the symptoms, then I think you should go and check. Go to the nearest clinic and get them to check you and make sure that you don't have you don't have a COVID. But in the event, it's easy for those that already know that they have come in contact with someone who has had COVID. Okay, because then you know the chain of events. You isolate yourself, and if necessary, you quarantine yourself. Okay, but for those of you who don't know but you have the symptoms, then what you should do is you should go to the nearest clinic or to the nearest health center. The government of Malaysia has actually put up an extreme network of medical centers all over the country. So I think it's very easy to go and look for a proper medical center and test for COVID. Okay, and there are two types of tests for COVID. As you know, one is the antigen test, which is a rapid test. The accuracy is not so accurate, but it's good for a screening purposes. But if you think that you have come in contact with someone who has had COVID, it is best that you do the PCR, which is more confirmatory.
Okay,
Okay.
understood. So the next question. So this, I'm sure that people out there are curious to know about this. So even some people still unsure about COVID-19. So even they started to feel, so still to have flu or any symptoms, they feel like, oh, this is COVID-19. So can you tell the difference between flu and COVID-19, and how can they assess themselves from home before visiting the hospital if they are unwell?
Okay. Okay, I explained this in the beginning. You see, when you're exposed to a virus, most of the time we all have the same symptoms. We have flu, we have some fever, all right? This is the normal thing that when we are exposed to any virus, correct? But in COVID 19, I repeat, in COVID 19, it's a little bit different in the sense that it involves our breathing pattern because it goes and gets into the lung. So we start having fever, we have dry cough. Most of the time, the cough is dry, and you feel fatigue. Fatigue means you feel tired. Rasa badan, rasa lenguh. You feel fatigued. And then you also will have a lot of other issues like sore throat, headache, joint pain. You have a lot of joint pain. And then you can have some skin rash on the skin. Ada ruam akan naik pada kulit. All this. And then you may have diarrhea, you may have vomiting. So this is a bit different. And the moment you have fever with any of the symptoms that I just told you, then I think you should go and check whether you've been exposed to COVID-19.
Alright.
Alright. Okay, moving to the next question, Dato. What should I do if I am diagnosed with the coronavirus infection?
Okay, now assuming you have gone to the clinic and you have tested yourself, correct? You have tested, and then they said,
Yes.
okay, you have your COVID antigen is positive. Okay, then you need to quarantine yourself. Okay, now there are two types of people. The ones that do not have symptoms. You may have COVID, but you don't carry any symptoms. You say, look, I feel very well. So what you need to do is just quarantine yourself for 10 days. All right. Now, when you quarantine yourself for 10 days, what happens is in the 10 days period, you observe yourself and see whether you develop any of the symptoms that I just told you. Okay. Now, in the event, okay, before I talk about go any further, when I say quarantine, it basically means you stay indoors, all right? You wear a mask, okay? You maintain a 1 meter distance from anybody, and stay within your room, within the confines of your room in your house. So if at all anybody needs to send you any food, then I think it will be has to be done through the door. They just leave it at the door, then you eat, and then you leave it outside. But most important thing is always the hygiene, hand washing, wearing a mask, and maintaining the 1 meter distance. I think that is very important. Now, number two, if you have any of the symptoms, any of the symptoms that I just told you about, all right? Now, if you have any of the symptoms that I just told you about, what would you do? Then you will have to go back to the health office and tell them that you are developing symptoms like rasa susah nak nafas, your dry cough getting worse. Then you probably need to be admitted. You and then once they admit you, they will isolate you. Okay. So if you are not serious, then you probably be just in the hospital. They will observe you over a period of 14 days. And normally, after the test is done, they will repeat another test on the 10th day. And if you are okay on the 13th day, on the 14th day, you can go home. So this is how the whole thing works.
Mhm. Okay, understood, Dato. So I'm interested with what you talk about quarantine. So once the person had been called to the quarantine center due to COVID-19, so what are the things that they should bring with them to the center to ensure that accommodate the hospital's requirements? So maybe you can share with the
Okay.
viewers.
Yeah. Okay. Good question. Although I am not sure what you bring, but over the last 15 months, we've watched videos about what people bring to the hospital because I'm in the private sector. But I can tell you what we do here. But generally, you have to take all your general things like your toiletries, your toothbrush, your shaver, some soap, a towel, a couple of clothes for changing, and things like that in a simple small bag. You don't have to carry carry a big luggage of 15 kilos or 20 kilos like when you're traveling around the world. You just need a simple bag with some simple basic that you need on a day-to-day basis. Okay, that's number one. Number two, when you're tested positive, the health office will actually send an ambulance to pick you up. So the ambulance that picks you up will give you all the directions, and then they will take you to a hospital. Depending which state you are or which district you are, then they have designated hospitals and wards which are for only for COVID-19 patients. And they are normally kept there for about 10 to 13 days. And on the 14th day, if everything is okay, they will charge home. And of course, you're allowed to bring in your handphones, and you can actually video call your loved ones and your family members.
All right. So,
Alright. Okay, Doctor, how long will COVID-19 symptom last? What are the complications that the person with COVID-19 will be facing, and what are the long-term effects to their body after they had survived COVID-19?
Okay, I think this is a very good question because you see, what we see today, those who have recovered from COVID, those who have recovered have gone home, they are well, but they continue to have generalized body ache. Some of them continue to have these fatigue symptoms, rasa lengur, rasa badan sakit. These are things that they continue to have, although they are no longer infective. That means they no longer have the disease, but these are the symptoms that they have from their discharge. Right? So normally the hospitals will decide. This is a WHO requirement actually. Isolation on the 14th day is only if they are with us. Assuming if they have symptoms, then they will probably stay on a couple of more days in the hospital. But otherwise, if everything goes well, according to WHO, on the 14th day, I think they are allowed to go home.
okay, understood, Dato. So looks like we have questions from the viewers today. So Dato,
Okay.
one of our viewers asked you regarding is the pulse oximeter can detect COVID-19?
Okay. This has become a hot topic today. Everybody is buying a pulse oximeter. I bought one too.
Oh,
Now it's a
okay.
good thing. You guys are young, so sometimes you don't have medical problems. But as you grow older, many people have medical related problems. They have heart problem, they have diabetes, they have high blood pressure, they have cancer, they have other loads of other problems. All right. So the best easy way of detecting when you put a pulse oximeter is put onto the finger. All right, it's kept on the finger here. It detects the oxygenation level. Oxygenation level means how much oxygen is there. All right. Now you got to buy a good pulse oximeter to get a good result. Okay. Now some of us go and some people go online and they buy some pulse oximeter uh, the online stores, and when it comes, you're not sure whether it really works. Okay, but I think buying a good pulse oximeter is important so that you maintain your pulse, your oxygen saturation above 90. An individual should be anything falls less than 95% in a normal individual. I think you got to get a little worried. All right, you must be a little bit worried, and if necessary, if you think you have any of the symptoms, I repeat again, if you think you have any of the symptoms that I just mentioned just now, you may want to go and see your doctor and just get yourself checked. Okay, but pulse oximeter and widely available in every online store, and I think you can just buy anything off the shelf.
Yeah, okay. But you should buy the quality one, right, Dato?
Yeah, don't want to buy a cheap one and think that it should work like an expensive one, isn't it? So
Yeah.
I don't want to mention cars because then some people might come after me. said, "Oh, you're trying to promote some particular caste." Yes.
Okay. Okay, so moving on to the next question. How about for a COVID-19 person that had been survived? So what is the duration that is deemed safe for the person to be around others?
Okay. Now, according to WHO, they normally they have recommended 14 days, because after 14 days, and if the person does not have any symptoms, they're actually fit to go home. All right. So I have neighbors who are COVID positive, and they've all come out of hospital after 14 days, and they're already back doing their normal things. But of course, like I said earlier, many of them still continue to experience fatigue. Fatigue means feeling tired, and many of them also continue to experience body ache. Body ache and joint pain and things like this. So this applies to some. But most important, I think all over the world, I think our government is also emphasizing on this, and I hope this message goes to everyone. I think most importantly is to maintain strict SOP, that is wearing a mask, hand washing, and maintaining a 1 meter distance. And please try to do this at all times. So, whenever you get a chance to wash your hands and clean your hands, please do that. And whenever you come in contact with anyone, please don't touch your face, don't touch your nose, or don't touch your mouth, because this is the route in which the COVID-19 will spread. That is your nose and your mouth. So be very careful.
Okay. Okay, Doctor. How to safely quarantine COVID-19 person or the person under surveillance at home?
Okay, like I said earlier, the best way, there are two things to do. Okay, one is a quarantine and one is an isolation. Okay, now quarantine is used for anyone who is contact with an infected COVID patient, which causes the infected patient to have symptoms. Quarantine basically means you remain separated from others. That means you don't come in contact with others. So if you are staying in a house, you have your own room, so you stay indoors in your own room and not go out and mix with your parents. All right. So you maintain that
Okay.
for at least 14 days. All right. Or in whichever facility that you're staying besides your house. That's for quarantine. For isolation, on the other hand, isolation is basically done in the hospitals, all right, or isolation centers. So it's not in the house. And here also, it's another 10 to 14 days. And isolation periods may actually prolong depending on individual. If you do not have symptoms, you can go off after 14 days. If you have symptoms, you probably stay longer.
All right, Dato. So for viewers today, don't forget to ask questions. If you have any questions that comes in your mind, so don't hesitate to drop your questions in the comment section. So moving on to the next question, could you share with us the types of vaccines that are available for the public? So I'm sure that public would like to know
Oh,
more
okay.
about vaccines.
I think this is a hot topic, isn't it? Everybody wants to
Yeah.
know about the types of vaccines that we have. Now, for now, as per WHO, I think the vaccines that are available is the Pfizer Bio Tech vaccine. Then you also have the AstraZeneca vaccine, which is produced in Oxford. Then you have the one from India, which is from the Serum Institute of India, the SK Bio. Then you have the ones from the Johnson and Johnson, and also the ones from China, which is not stated in the WHO website, but otherwise we have the Sinovac vaccine from China. So basically now in Malaysia, I think we only have three to date. That is the Sinovac, AstraZeneca, and the Pfizer vaccine. And I think soon other vaccines will be coming in. I think there's also the Sinopharm that's listed in WHO, which is from China, from Beijing.
Okay, Doctor. Can you share with us? Okay, Doctor. Can you share with us what are the possible side effects after getting the COVID-19 vaccine? any useful tip for us to reduce or overcome the side effects? Because some of my friends after get the vaccine they got fever, joint pain, and some of them got vomit. So can you share with us
Okay, good.
any useful tips?
All right. I had my vaccine in March, end of March, and ours was the Pfizer vaccine. We were the pioneer group because we are the frontliners. So ours is a Pfizer group, which is the mRNA vaccine. Now, vaccine, like any vaccine, whenever you put a vaccine inside, so your body will tend to react to the vaccine. Okay, so the way it reacts is, number one, you may have some pain over the injection site. Some people have some fever. Some people have body ache. All right, but all this is very transient. Transient means it's a short acting thing. Normally it is over within the first 24 to 48 hours. All right, now we have been advised by most medical systems that to only take panadols and not painkillers. All right, so you are only advised to take panadol, which is paracetamol, if in the event if you have any pain. So because there have been some side effects by people who have taken painkillers, and that has probably reacted and caused some unforgiving medical effects, which we shall not go into. Because, but I think the most important thing is, do not get worried, do not get upset when you have a little bit of soreness in your arm and you have a little bit of fever. It's basically your body is reacting, which is a good sign. Okay, so it's a good sign that that means you
Oh,
have
okay.
to the vaccine. So, and it's only temporary, and then after that, life goes on as usual.
Yes, Dato.
So please tell
So,
vaccinated.
okay, yes. So to all our viewers,
Okay.
please get vaccinated. Okay, moving on to the next question. As we all know that nowadays there are many variants due to mutations to this COVID-19 virus. So would the vaccine we take be sufficient for all of us, and do we need to keep being vaccinated to all the possible variants there are? So
Okay,
your
now
opinion.
that's a very tricky question. See, today we are all reading about new variants. Variants basically means the virus is mutating, it's changing its pattern. All right. Today it is A, tomorrow it's B, day after tomorrow it's C, then it becomes D, then it becomes E. We don't know. Things are moving, it's changing. Okay. So this is something, it's an enemy that we don't see. All right. We are fighting against something that we can't see, but we can prevent. We can't see, but we can help prevent from getting infected if we follow the SOP, which is distancing ourselves, avoid crowded places, wearing a mask, washing hands, and stop touching any part of our face. Now, of late, I mean, this I can just share with you. Of late, of course, everybody is talking about the Delta variant, and the Delta variant has proven to be very deadly, and it is spreading very fast. It is everywhere, but we don't know who is going to get this Delta variant. All right. Now, once you get vaccinated, it doesn't mean that you are completely protected from the virus. No, you are protected up to a certain time. So maybe after 12 months, WHO probably will come out in another couple of months and tell us when will be the next vaccine due. Just like every other vaccine, just like your hepatitis vaccine, your influenza vaccine. When we have influenza vaccine, we have it every year because that's something that we have been taught to do. So likewise, I think coming to COVID-19 vaccine, I think it will probably be on a yearly basis. I don't know. I believe that it will be on a yearly basis, but we will wait for the authorities to feed us and give us more information.
Okay, just out of curiosity, Dato, can we get COVID-19 from our pets that were roaming around and come back to us? This is for those who have pets outside of their homes, like village or rural areas.
Okay, this is something that has been debated on numerous occasions. People have spoken about pets. Now, I'll put it to you this way. I won't give you a direct answer, but I will just give you a precautionary statement. Okay. Now, if you have a pet, and if your pet lives inside your house, and only it's just you and your pet, I feel there is no issues, because as long as because you are the one who is going to be the carrier. The pet is not the carrier. We are the carriers. Okay. Because as you know, COVID-19 is spread by droplets, by coughing, by sneezing. It's a droplet disease, correct? So when somebody
Correct.
coughs or sneezes, these droplets are the ones that spread and spreads on to us, correct? Now, if we are masked and if we stand 1 meter away, then our risk of getting infected is less. I wouldn't say no, but less. Likewise, if assuming someone who is COVID positive and your pet moves out of your house, goes to your neighbor's house or somewhere around the neighborhood, and the person who pets it is COVID positive, now we don't know whether the fur and the droplets on the fur from whoever has positive COVID and your pet comes home, and when you touch, whether you're going to begin, I think that is something for us all to take precaution and try as far as possible not to let the pets out, because we don't know. But I have a feeling if I were you, I won't let my pets out.
Okay. Okay, Dato. We got a question from our viewers. How long after we have recovered from COVID that we can take our first COVID vaccine? And also, if get COVID after first, and also if you get COVID after first jab, how long later can you take the second jab?
Okay, the question is, if you already have COVID, and then when do you get your vaccine? Actually, for those of you who already had COVID, your body has already developed an immunity to the virus. Okay, so you are actually naturally immunized against the virus. Okay, but there is no harm in you taking a vaccine. So once you are well, and if you don't have any symptoms, you don't have all these body aches and pain and flu and the lethargy, yeah, I think you're fit to go and get your first dose. And the second dose is normally given anything between 3 to 4 weeks. Some people have it earlier, some people have it a little later. I think now it all depends on the availability of the injections of the vaccines.
Okay, so Dato, moving on to the next question from our viewers. I think it's very interesting, this question.
Yeah,
Dato, so can we take durian after having vaccination?
it's quite hot topic.
The hot
I'm
topic.
sure this is
I mean,
durian
Yeah.
lover.
it was yesterday that someone actually posted something on the internet about someone collapsing after having vaccine and having a durian. Now, there's nothing on WHO that says that you can't take any kinds of food or any kinds of fruit. Now, I'll put it to you this way: when you know that something is dangerous in front of you, if I were you, I won't go there. So
Yeah.
for those durian lovers, I think you should just put it on hold for a while until you are well, and before you want to try and taste your durians, right? Because the durians are going to be here forever, okay? And for us to taste whatever is
Yeah.
there forever, we will also be alive for that. So I think let's be
Mm.
alive first. Let's stay alive, stay safe before we touch our durians.
Yeah.
Yes.
Okay, looks like we are at the end of our Facebook live session. Before that, thank you, Dato, for spending your time with us, answer question by question. Thank you so much.
Thank you.
Well, thank you, Balkis, and thank you, Aliza. I think you guys have been wonderful, and most importantly, I must thank all the backroom people of Complex Bukit Jambul. I think you have put in a lot of effort into this program, and of course, I would like to a personal thanks to your chairman, Chan KH, for having started the CSR program. And I wish you all the very best. And most importantly, stay safe and stay alive. And please follow the SOP of the COVID-19 virus.
Alright, thank you so much, Dato. So with that being mentioned to all our viewers, we are from Complex Bukit Jambul. We would like to express our gratitude to all our viewers for joining us today. So please stay at home, strictly follow all the SOP, and stay safe, everyone. See you in another time. Bye.
Bye.
Bye.